Good afternoon, everybody. The Senate Finance Committee is in session for voting. Voting list number 21. And which one of the analysts is going first? All right, so David.
I think Senator Feldman will want to kick things off here on 833.
Okay. So guys, you have a reprint that, we just generated and wherever that reprint, do we have a reprint? We've got the
They
reprint.
should have the reprint.
So what I was hoping on this one, look, these are significant issues. We had the hearings last week. I mean, I think, the bottom line is, I think at this point, the issue of the referendum and then dealing with criminal justice and a few other things, I think, is where we are between the two chambers. I think the House, if you recall, was in a referendum-only mode. I think we got to get mass incarceration stopped, and then a few other things. So we're not, my intention here today, and I said this to Senator Reedy, I never want to jam stuff out, right? Like, I want this to be methodical, thoughtful, whatever we do on some of these bills. So I think what the plan here is to have Dave walk through this reprint, and anything on the constitutional amendment we can certainly take up as well. And then we'll take it up. I think we'll take it up tomorrow, though. But I want everybody to see what's at least in this reprint, and then just have a conversation, and then we'll see where we are. But my plan, we're not going to vote it today. Is
Okay.
my main message. So.
And in that case, what I'm going to suggest, David, is that we go through the
Yeah, let's
others,
go through everything else.
and then we'll come back to that. Yes.
Just so I understand, we're going through a reprint of your bill? Is that correct?
Yeah, but to be clear, when we take up the House bill, they will be amended to be essentially the same. And then you'll have HB 1, which is the referendum. But the two bills are, however we vote on the bills, or however we take up the bills, they're going to be in the same posture.
Okay, but we are going to take up your bill. It just almost, the way you spoke just now,
Yeah.
it sounded like you were conceding that we were not going to be moving your bill.
No, I mean, look,
Oh,
if you want to
no.
move my bill and keep the House bill here, that's fine, but I don't know. We'll move it all together.
Okay.
We'll talk about that tomorrow.
Got it.
Okay. All right, David.
All right, so we'll skip down to the other bills on the list. These are bills that, I can't even remember. These bills are cross-filed bills that did not pass the Senate unanimously. And you'll have a few decisions to make on, in some cases, they may have passed unanimously, but there's some changes too. So these are cross-filed bills that are either changed from the Senate bill, the House bill is changed, or they didn't pass the Senate unanimously. So the first bill is House Bill 49. This is a cross-file to House Bill 3, or Senate Bill 380, or Senator Benson's bill. The difference in these bills is the House bill uses better choice of words regarding registered nurse. When I was drafting amendments, I didn't speak that language very well. So the House has a better use of registered nurse versus how it's used in the Senate bill. So on this one, you'd probably just want to pass the House bill clean, and then they would conform the Senate bill to the House bill.
Okay, any discussion on the motion? If not, all in favor, raise your hands. Okay, that's unanimous, and you see who's here. Okay.
Okay, the next bill is House Bill 90. This is the collective bargaining bill for public defenders. The bill is the same as the Senate bill, but this bill obviously did not pass the Senate in the same unanimously, so it is here before you to move on the House bill. It is in the same posture as the Senate bill.
All right, we've got a motion and a second. Any discussion on this motion? All right, if not, all in favor, please raise your hand. Let's see what that shows. Okay, we'll need to call the roll.
House Bill 90, favorable. Senator Feldman? Aye. Senator Klausmeier?
Yes.
Yes. Senator Benson? Yes. Senator Kramer?
Yes.
Yes. Senator Hayes? Yes. Senator Reedy? No. Senator Augustine?
Yes.
Yes. Senator Vital? Yes. Yes. Senator Jennings? No. No. Madam Chair?
Yes.
Yes. Bill passes.
The next bill is House Bill 166. This is the cross-file to Senator Augustine's bill about the Alzheimer's Disease Dementia Council and Coordination of Services. There's a couple differences in the bill. There's some language difference on page 6 that says, they added, and when you're talking about what the responsibilities of established director is, they added and brain health, including through public awareness, prevention, and early detection and diagnosis. That's not in the Senate bill, but primarily the significant difference is the House added mandated appropriations for this position and to also fund the council activities. So I guess it's up to Senator Augustine, what do you want to proceed?
With it, move it as the House version, assuming that we got an okay from, from a budget standpoint, that's fine.
Well, this falls under the cap anyway, so.
So I would say let's move the bill, the way that it is.
Okay, we got a motion and a second and a discussion on the motion.
House wins again.
If not, if you're ready for the question, all in favor, please raise your hand. Okay, that one's unanimous.
We got two more here quickly. House Bill 270, this is the innkeeper bill and human trafficking. It's largely the same as the Senate bill. There's the two differences here is on page 3, the House left in language reporting that you could report, that one of the folks to report an instance of human trafficking to would be the Governor's Office of Crime Prevention, Youth and Victim Services. And they made it an and, so the innkeeper would have to report to all law enforcement, the National Human Trafficking Resource Center, and the Governor's Office. You probably want to go with the Senate version and make it an or, otherwise it's going to be pretty burdensome for these folks.
I'll motion that we amend the House bill to the Senate bill.
Okay, we've got a motion and a second to amend the House bill to the Senate bill. All in favor, please raise your hand. All right, then we need to call the roll.
House Bill 270, favorable as amended. Senator Feldman? Aye. Senator Klausmeier?
Yeah.
Yes. Senator Benson?
Yes.
Yes. Senator Kramer?
Yes.
Yes. Senator Hayes? Yes. Senator Reedy? No. Senator Augustine?
Yes.
Yes. Senator Vital? Yes. Senator Jennings? No. Madam Chair?
Yes.
Yes.
All right, the bill passes.
Last bill on the first page is House Bill 510. This is the one that authorizes the Health Services Cost Review Commission to raise it alters how they would assess fees on those who they regulate. It's the same posture as Senator Augustine's bill, but the vote was not unanimous.
Move favorable.
Second.
All right, any discussion on that motion? If not, all in favor, let's raise your hands. Is that one? All right. Hayes, are you raising your hand? No. Okay, all right, then we need to call the roll.
House Bill 510, favorable. Senator Feldman? Aye. Senator Klausmeier?
Yeah.
Yes. Senator Benson?
Yes.
Yes. Senator Kramer?
Yes.
Yes. Senator Hayes? No. Senator Reedy?
No.
No. Senator Augustine?
Yes.
Yes. Senator Vital?
Yes.
Yes. Senator Jennings? No. Madam Chair?
Yes.
Yes. Bill
All
passes.
right, thank you. It's 8-2, okay.
So moving along to the next page of the voting list. First is House Bill 129, a copy of which is at your desk. It is substantially similar to Senate Bill 12, which passed the Senate unanimously earlier this session. The only difference is on page 7 of the House bill. The written policy developed by the PSAP must include training for applicable staff on implementing the procedures.
Move favorable.
All right, yes, Senator Reedy?
Be reminded about this bill. This bill was the one that said for these grants that are underneath the Department of Health that are focused on reducing impact of law enforcement with the community dealing with mental health crisis, that's what this is saying. It has to be prioritized toward grants for that, correct? We had this bill already. Okay,
This is the cross file that I have.
that's right, okay.
Yes.
Thank you.
Yep.
Okay. All right. All in favor, please raise your hand. All right, that's unanimous.
All right, Tammy. The next bill is House Bill 253, which is identical to Senate Bill 655, which passed the Senate earlier this session. It's on the list because the votes were not unanimous.
Okay. Do we have a motion? All right, Senator Bidle has moved the bill. Do we? All right, Senator Benson has seconded. All in favor, let's raise your hands. Let's see, All right. Senator Reed, are you voting?
Can I abstain? Because I need to look at how it voted.
Okay, then we'll just call the roll. Okay.
House Bill 253, Senator Feldman. Aye. Senator Klausmeyer.
Yes.
Yes. Senator Benson.
Yes.
Yes. Senator Kramer.
Yes.
Yes. Senator Hayes.
Yes.
Yes. Senator Reedy.
Pass.
Pass. Senator Augustine.
Yes.
Yes. Senator Bidle.
Yes.
Yes. Senator Jennings.
Senator Hershey is here too.
Madam Chair.
Yes.
Yes.
Senator Hershey, we were calling the roll on 253, House Bill 253. Do you want to vote?
Senator Hershey, I just looked it up, and you and I and Senator Jennings opposed it.
Oh, that's correct.
Okay. Senator
Okay.
Hershey, no. Senator Reedy, no.
Okay. All right. Let's move on. Yeah, down to 287.
Yes, ma'am. The next bill is House Bill 287, which requires the Secretary of Health to be professionally qualified through experience or education in at least one of 4 enumerated areas. The bill is identical to Senate Bill 243 as introduced. However, Senate Bill 243 was recommitted to the Finance Committee after an amendment was applied. The House bill does not have that amendment added to it.
You want to tell us what the amendment was?
The amendment to the Senate bill affected the deputy secretaries of health and establishing requirements for those positions.
Or just a minute, put your light on if you want to speak, Senator.
Yeah,
Miller.
okay, just to refresh everybody's memory, we had these amendments dealing with the deputies. We went out to the floor, there was some pushback from Senator Rosapep, I think in particular. So I decided to bring the bill back, and so the bill as it is the same as the cross file, which I sponsored. That basically just goes to the very minimal qualifications, I might add, for our Secretary of Health, but without the amendments on dealing with the deputies. So that's where the bill is now. We voted out the bill that had the additional amendments, if you recall, to the floor. But, so anyway, I plan to vote for the bill clean without any amendments. And I think clean, the bill is likely not to get pushback from Senator Rosapep in particular, but there wasn't a lot of discussion on the floor. Now, Senator Lamb may try to offer those same amendments on the floor. That's why I asked Delegate Pena-Melenik last week when she was here if she had a position on those amendments. And she urged the committee to just pass the bill as is, only dealing with the health secretary and nobody else. So that's hopefully, in a nutshell, refreshing everybody's memory on the sequence there, but.
Okay, Senator Hayes.
So anyways, I'll just put out the motion, favorable, clean, no amendments, and discussion obviously is appropriate, but I'll just put the favorable motion.
Okay. Senator Hayes.
Yeah, I'm trying to figure out what the origin of the amendments were, but on a floor system, it looked like the amendments around the deputies was introduced by Senate Finance. Is that true?
Right, so. We did, candidly, Senator Lamb was the impetus for those amendments, and we did put them on here in this committee and
And we
then sent them
adopted
to
them.
we adopted them in the committee, sent it back out. Those amendments drew attention, so we decided to pull the bill back. So, that's basically it. So it's the same bill that was as introduced,
Right.
clean, without those amendments that
But
caused.
what we're saying now is, although we voted on the bill and the amendments with the deputies included, this vote, if we were to vote it clean, would not include the deputy.
That's right.
Correct.
Thank you.
All right, Senator Kramer?
So now we're back to this requirement that the secretary be the individual that is what was it, Senator Feldman, a licensed physician, what was it that
No.
this requirement?
No, actually, we went so far below that. I had made the point at the hearing that we require some of that for our local health officers, but when it comes to the
Right.
guy that controls a third of our budget, we listed 5 categories, none of which involve them being a licensed physician, unlike 20 other states that actually have those requirements. We're keeping it so bare minimum, but at least you have to have, there's 5 categories. All you have to do, meet is one.
One of those 5 then.
One, and none of that requires you to be a physician licensed or
And then
otherwise.
the amendments dropped that requirement to the deputies, or?
No, the deputies was a whole different the deputies there's 5 different deputies, and when it came to the deputy who's responsible for public health, that one did require not a licensed physician, but like some duly licensed in some healthcare area. It could have been a nurse or So that whole thing was down at the deputy level. We never applied that much highest standard here on the health secretary themselves. They just had to meet one of the 5.
One of those 5 standards, okay.
Okay, just so I'm clear, the bill that's before us today is back clean the way we left it.
It's the House bill, but it's
Okay.
just the clean, no amendments dealing with deputies.
All right, did we already get,
I move favorable.
all right, all right, we got a motion and a favorable, any further discussion on this bill? All right, all in favor, please raise your hands. All right, well, it looks like, we need to call the roll, just to be clear.
House Bill 287 favorable, Senator Feldman. Aye. Senator Klausmeyer.
Yes.
Yes. Senator Benson.
Yes.
Yes. Senator Kramer.
There was a lot of pushback on the floor on this bill.
There
With the
was.
amendments.
That was with the amendment.
Was it just the amendment?
Yeah.
or The concept?
No, I think it was the amendment.
House vote was unanimous, so I don't know for what it's worth.
I'll go yes.
Senator Kramer, yes.
All right,
Senator Hayes. Yes. Senator Reedy. No. Senator Augustine.
Yes.
Yes. Senator Vital. Yes. Senator Hershey. No. Senator Jennings. No. Madam Chair.
yes,
Yes.
all right,
8-3,
thank
bill
you.
passes.
Okay,
House Bill 622 is next on the list, and it's identical to Senate Bill 526, which passed the Senate earlier this session. So the bill modifies the offshore wind renewable energy credit mechanism under the RPS.
all right, do we have a motion?
Move favorable.
All right, we got a motion and a second.
Second.
All right, any discussion on the motion? Senator Hershey?
Amended to the way that we passed it out of the Senate?
It's identical to it as it was sent over.
I thought we put some amendments on
We
this
did,
one.
you did, and the House applied the same
Oh, okay.
amendments.
Okay, so it's identical to what we passed?
It is identical to Senate Bill 526, which already passed the Senate, yes.
All right, any further discussion? All in favor, please raise your hands. All right, that's unanimous, okay.
Next bill is House Bill 669, which is identical to Senate Bill 166, which passed the Senate earlier this session. So this is the bill that deals with doulas and requires the Department of Health to, among other things, ensure that doulas providing care under Medicaid are participating doulas, requires the department to review participation in Medicaid of participating doulas and program recipients and evaluate the effectiveness of the services covered by Medicaid. It also establishes requirements for participating doulas and specification for covered doula services. And the bill specifically may not be construed to limit the authority of the Health Services Cost Review Commission to set the appropriate rates for hospital services. Again, it's identical to Senate Bill 166.
All right, do we have a motion? All right, any second?
I'm sorry, I have a question.
Yes. It's identical to what we passed.
It says over here, Senate Bill 503. Is that something different?
So, as you'll recall, there were two doula bills that were introduced this year, one by Senator Ellis and the other by Senator Lamb. The bill that was introduced by Senator Ellis is the one that ultimately passed the Senate, but it was amended to conform with Senate Bill 503 as introduced by Senator Lamb, and then some additional amendments were added to it. So the bill before you is identical to Senate Bill 166. The reason that it is not the noted cross-file to the House bill is because of that change that was made to Senate Bill 166 so that Senator Ellis, who had long been a proponent of doula services, could have his bill advance.
Okay, thank you.
All right. Any further discussion? All right. All in favor, please raise your hand. Senator Reedy, are you voting? Okay. All right. We need to call the roll.
House Bill 669, favorable. Senator Feldman? Aye. Senator Klausmeyer?
Yeah.
Yes. Senator Benson? Aye. Senator Kramer?
Yes.
Yes. Senator Hayes?
Yes.
Yes. Senator Reedy? No. Senator Augustine?
Yes.
Yes. Senator Beidle?
Yes.
Yes. Senator Hershey?
No.
No. Senator Jennings?
Yes.
Yes. Madam Chair?
Yes.
Yes.
All
Bill
right.
passes.
You want to rethink your vote on that?
Okay. All right, the bill passes. Okay.
Okay, House Bill 141 is the next bill on the list. This is the same as Senate Bill 23, which passed the Senate earlier this session. It requires the Maryland Department of Transportation, before announcing or proposing any major service change, to conduct a transit equity analysis, perform a cost-benefit analysis, and consult with members and leaders of affected communities, and take certain actions based on the results of these activities. It's on the list because there were some votes against.
Second?
Okay, we've got a motion and a second. Any discussion on the motion? If not, if you're ready for the question, all in favor, raise your hand. All right, it looks like we need to call the roll.
House Bill 141, favorable. Senator Feldman? Aye. Senator Klausmeyer?
Yes.
Yes. Senator Benson?
Yes.
Yes. Senator Kramer?
Yes.
Yes. Senator Hayes? Yes. Senator Reedy? No. No. Senator Augustine? Yes. Senator Beidle?
Yes.
Yes. Senator Hershey? No. Senator Jennings? No. Madam Chair?
Yes.
Yes.
Okay, thank you.
Okay, House Bill, House Bill 413, this is the health insurance individual market stabilization, extension of provider fee legislation. There was a Senate bill that was heard earlier this session. The Finance Committee hasn't acted on that. This is the administration bill that extends the existing state health insurance provider fee assessment through calendar 2028 to assist in the continued stabilization of the individual health insurance market. As amended by the House, the bill exempts standalone dental and vision plans from certain regulatory assessments for each year in which the health insurance provider fee is paid by these plans. In addition, the bill provides that funds received from the health insurance provider fee assessment may only be used for the state reinsurance program and other authorized purposes established under current law. The bill also requires the Maryland Insurance Administration, in consultation with the Maryland Health Benefit Exchange and Maryland Health Care Commission, to submit a report on the impact of the reinsurance program by December 1st, 2023. In developing the report, MIA must consider certain things such as, including whether the level of funding is appropriate, take into account future population growth and projected premium growth, to consider whether the assessment established under, whether this assessment is appropriately apportioned among the carriers, should be broadened to include other business sectors, and should be supplanted with general funds. The House also wouldn't have the study include to consider what market reforms are needed to provide affordable health coverage in the individual market, including continuation of the reinsurance program past 2026, providing state-based premium subsidies and expanding eligibility for the Medicaid program, and then to evaluate the design of the reinsurance program, including whether the program parameters established in statute are appropriate in light of other individual market reforms at the state and federal level, including the Young Adult Subsidies Program, the Easy Enrollment Health Insurance Program, special or other enrollment periods open under statute, and premium subsidies available under the Federal American Rescue Plan Act or any other federal law. The report then must include options for obtaining sustainable funding sources to support stability in the individual market.
Okay. Yes, Senator Klossmeyer.
I have been inundated with questions all day long about this bill. And I've been at a funeral too, but in the meantime, I even got them there. So is there a way I just would like to hold this until tomorrow, and maybe everyone can get together and sit down and talk to me about the bill and tell me what you want.
All right, well, that's the request. How you guys feel about the request? You want to hold it till tomorrow? I'm sure we'll be voting it sometime tomorrow.
Sometime tomorrow, I promise.
Okay, well, let's hold it for one day.
And the next bill is House Bill 778. This is identical to Senate Bill 514, which passed the Senate earlier this session. This is the bill that requires MTA to establish individual investment programs to advance the MARC Cornerstone Plan and other MARC improvements. There were some votes against, so.
Okay? All right, Senator Hershey has moved it. Senator, you wanted to make that a second? All right, any discussion on the motion? If not, all in favor, please raise your hand. All right. No, he's not. Is your hand up? Okay, it is. All right, that's unanimous. All right, now we're going back to Senate Bill 833 for discussion.
Okay, so Senator Feldman gave you a brief introduction. I'll explain what's exactly in front of you. The reprint is of 833, but it doesn't look like your usual reprint. If we tried to save some paper here, because the reprint would have been 150 pages long. So what was done here is most of the original bill is introduced by Senator Feldman has been struck and is replaced largely with House Bill 837 as it came across the street. So, do you want the full reprint?
Yeah, this is the time of the year where people play games and sneak stuff.
Well, why don't we
Okay.
discuss this now?
Sure.
So is this theoretically saying that this is page one of the new bill?
This is page, since
One.
none of these pages are numbered, so when we're going through it, we numbered the pages themselves.
Reference for us, because up here I got page 77.
But if you go to the next page, there won't be any nothing numbered.
I need to go back to my initial question,
All
Madam
right.
Chair. That was, are we no longer discussing Senator Feldman's cannabis bill as the bill that, as still being viable? Because if I understood what you just said, David, this is Senator Feldman's bill now turned into the House bill
With additional changes, yes.
with some tweaking or a lot of the original bill?
just kind of in a nutshell, the bills that we had here, dealt with some criminal justice plus all the market stuff, right? The licensing and all that. We're not getting into that. So this is largely referendum plus criminal justice plus, yes, a few additional items. Senator Hayes had some ideas. There's a few things from Senator Carter's bill in there, but it's largely that plus an additional, some other stuff. And that's basically in a nutshell. So we're working largely from Delegate Chair Clippinger's criminal justice bill and referendum bill, and the bulk of the 833 bill is, we're not taking up this year, we'll take up next year.
Is that, well,
If
that's,
the referendum passes. Just remember, this bill only even kicks in if the referendum passes in November, the constitutional amendment referendum.
so
It's
it
contingent.
sounds a lot like, if I'm understanding it, we're punting on the framework, how it's going to be done. This is just, here's the concept, and we're going to have to deal with all of the structure, how it's going to be implemented next year on the assumption that,
Right. The
If-
priority here is to get rid of mass incarceration of folks for nonviolent small possessions of cannabis. That's the priority, with input from the voters of Maryland. And beyond that, laying some foundation for next year, tackling what is a more complicated set of issues, dealing with licensing and all the rest.
and the
Creating some
public health, the public welfare, the public safety pieces of all of this will be addressed
Yeah,
next
so
year?
well, no, I think actually in this bill, I think you'll be pleased to see a whole bunch of stuff on health issues, studies, before we get back. So you wait for Dave to explain all that, but we've
All right.
created a whole bunch of things that I think are specifically directed to you, Senator Kramer, and points that you've made on health effects and impacts on youth and that kind of thing. So that's in this bill. You'll see.
All righty
Okay.
then.
If there are no further questions, we'll let David take us through it.
Okay, as I said, this starts, in the back of Senator Phelps' bill, which is largely struck and replaced with provisions of House Bill 837. If you recall from Delegate Clippinger's testimony, you probably know everything that's in here, so I'll go through this quickly. First off, the bill begins with a baseline analysis, and this is also in the House bill, so I'll point out which items are not in the House bill. But this is in the House bill that came over, and it's a baseline analysis conducted by the Cannabis Commission, and it's to provide a baseline study of cannabis use in the state that includes a survey of patterns of use, all these items following patterns of use, including frequency of use, dosing, methods of consumption, and general perceptions among the various populations listed. Incidents of impaired driving, including arrests, accidents, and fatalities, hospitalizations related to cannabis use. These are all items that have been studied in other states as cannabis has been legalized in those states. There's nothing here. Many other states are already looking at this or had to look at this as part of their legalization. And at the bottom, you'll see that the study results are due before legalization would kick in. That's March 1st, 2023. If you go to the next page, which is hand-numbered page 2, at the top, you'll see that this study will become an annual review by the Cannabis Commission, this type of study. Going down the page, there's a fund that's established, and this would become effective on January 1st, 2023. It would be called the Cannabis Business Assistance Fund, and its purpose is to assist small minority-owned women and women-owned businesses enter the adult-use cannabis industry. Actually, a lot of this fund, Senator Feldman's bill had several funds in there, and this is sort of a combination of some of the elements of those funds into one place. So this would be in the Department of Commerce. Again, it's a special fund that would be be funded through the budget and any other monies that allowed to the fund. And its purpose is to provide grants or loans to small minority-owned or women-owned businesses to assist them through the licensing application if the referendum is approved and you come up with a licensing scheme for building an industry, then this fund would already be in place to start that process to help these folks get licensed in the industry. If you go to page 3, you'll see.
Yes.
It doesn't,
Talking to you, Mike.
well, I was waiting for the mic to come on. So it doesn't direct how much would go into the fund, or who would, how would it be determined?
That would be in the budget, and I don't know where the budget negotiations are, but there is the House at least set aside money for this program, and I don't know.
That's what I'm aware of. So how much is it that the House has set aside?
I heard something like 30 million.
Right.
30
And
to 40
that's
million.
30 million just for 1 year though, right?
That would, yeah, going forward, yeah, that would be for the next fiscal year, because you only do a budget.
You could only do it
Yeah.
annually at a time.
Yes.
But otherwise, outside of the appropriation that the budget committees has put in there, or the House committee has put in there, there's no percentage or whatever identified for how much will go into this fund. It would be on a year-to-year basis.
Yes, and obviously, you'll be back probably at some point next year, should the referendum be ratified. That certainly changes could be made to a lot of these funds if you want to develop a consistent revenue stream or something like that. But for now, the House thought it best just to leave it for money in the budget, and they got money in the budget this year, or upcoming fiscal year for this program.
Correct. Thank you.
Okay. Senator Benson?
Yeah, to follow up on what he just said, I'm just curious as to why they didn't put a money figure in, and whether or not the language could read that it's going to be ongoing, put a timeline, a time certain.
The fund is, there as long as the law is there. And obviously, they steered clear of a mandated appropriation, because next year you're going to have a lot more budgetary authority to write in an amount, whatever you want to go to this particular fund. And again, I would imagine that once it's legalized, you'll be back here again next year discussing a lot of things, including funds like this, and you could set aside, once you start developing an industry, you could set aside certain revenues from the taxation of that industry to put into this type of fund.
Okay, thank you.
Okay, so in the middle of page 3, these are the priority for this fund. And at the bottom of the page, you'll see that pieces of the state finance and procurement article are brought in. And this is something you need when you establish special funds. If you go to the top of page 4, we'll eventually be getting to the other 2 special funds that are going to be established by this bill. That's later on in the bill. One is the Cannabis Public Health Fund, and the other one is, this is from Senator Hayes, Community Reinvestment and Repair Fund. But we'll be talking about those in a little bit. On the middle of page 4, these begin the changes to the criminal law article as a result of ratification of the constitutional amendment legalizing cannabis in the state of Maryland. The process here, and it seems a little confusing at first, but what this is doing is saying, starting on January 1st, which is the last possible day, if the voters ratify the amendment, that's about the last possible day ratification would be official. So between January 1st, 2023 and July 1st, 2023, when legalization would actually occur based on the ratification of the constitutional amendment, the bill establishes, instead of the current structure staying in place where you have 10 grams or less and there's civil fines for that and multiple offenses, it simply defines a civil use amount and a personal use amount. And going forward, this is going to be what once it's legalized, this is going to be the framework under which all these laws are going to operate under the criminal law article regarding possession, simple possession, intent to distribute, all under the under the controlled dangerous substance provisions of the criminal law article. So a civil, at least for 6 months, there's only going to be civil fines for the, personal use or civil use amount. So the personal use amount is going to be cannabis does not exceed, I won't get into the rest of it. I think the part that most people are interested in is an amount that does not exceed 1.5 ounces. And then the civil use amount will be 1.5 to 2.5 ounces. Anything above 2.5 ounces will be still subject to possible distribution of cannabis provisions. So if you go down to the bottom of the page, this is the segment of the law that regards possessing a controlled dangerous substance. And again, for only a 6-month period, you'll see that they've taken out the language regarding 10 grams or less and substituted with personal use amount and civil use amount. And these changes are going to be consistent throughout this part of the bill. Again, nobody on this committee, including me, are not really the experts here, but this is what they're doing. They're saying no longer 10 grams. It's going to be a personal use amount going forward and a civil use amount. The personal amount, starting on July 1st, 2023, will be the legal amount you'll be able to have, and that's going to be 1.5 ounces of cannabis. And then above 1.5 to 2.5 is going to be the civil amount, so you can only get a civil fine for that. Anything above that, you still could be considered intent to distribute, and there are differing penalties for that, but they're still much higher, and they could involve imprisonment depending on what you're doing. So there isn't that much change to anything regarding the distribution of above the civil amount. That would still be considered similar to what you have now going forward.
Real
Yes,
fast about that.
talking to you, Mike.
Yeah. So, and I know we're not the committee that deals with a lot of these sort of criminal things. I've been on a committee that does that. I'm confused by the civil amount thing. Why don't we just have a level, if we're gonna do this, why not just have a level where you can have up to this amount or not? I guess I can understand the need for some kind of buffer, but that's a big buffer. Like, I guess if we think if it shouldn't be criminal, it shouldn't, you know what I'm saying? Like, I don't understand the rationale. We didn't get to sit through the hearings on this.
I would imagine the rationale is, again, going along the lines of where the law has been going recently regarding decriminalization of small amounts. Well, now you're making it legal, and you set a parameter of 1.5 ounces. But they still, it's this, and this is only simple possession. This is not anything more than that. So for simple possession, you're still allowing a range of amounts that would only apply to certain civil fines as specified in the bill.
The term civil use seems so strange to me.
They came out, I think it's related to the fact that you could get a civil fine for there's nothing criminal about that. It's a civil fine. The drafters were trying to come up with a way to make this actually as simple as possible going forward when you're making all these changes to the code, and this is something they settled on over in the House. And
Yeah, I just worry you're gonna have, it's weird to me to have like a 2-tiered or 3-tiered system where, over 2.5 is criminal, and I won't belabor the point. And you haven't gotten to where they've talked about the fines yet, right? So we'll talk about that later.
well, the fines are, you'll see that the fines are,
$50.
well, I think it's a civil fine not exceeding $100. If you go to middle of page 5, at least for the 6-month period, it's a $100 fine for a violation of for personal use. You're still technically, even if you have a personal use amount, you're still technically subject to a civil fine of $100. If it's a civil amount, it's $250. And I think these fines I can't remember it, as we go where once legalization is, those fines may change a little bit, and they sort of shift around a little.
Yeah, I have some questions about that, but that can wait. Thank you very much. I'm just curious about the civil use
Let
stuff.
me ask a question then. Is the point that if you've got a civil fine for a low amount, and you show up somewhere on the street or in public with 15 or 20 times that, you obviously are in business, and you ought to be paying taxes on your business arrangement. It's not obviously for private use, which is what the point was for the civil fine, wasn't it?
Well, I mean, those, if you're driving around with a suitcase full of cannabis, I would, and there's no retail sale of it yet, and I don't even know if you're walking around, that would constitute retail sale as envisioned whenever you get to that point. That would still, you would still be subject to possible criminal misdemeanor and 6 months in prison for having a suitcase full of cannabis, if you're walking around the street with that.
Thank you.
Okay, if you go further down on page 5, you'll see that under current law, smoking marijuana, which would now be called cannabis, is illegal in public. That is maintained. The fine is reduced, though, to $50 for a first finding of guilt and $150 for a second finding of guilt for smoking cannabis in public. If you go to page 6, okay, at the top you'll see section 4. This is what the law will become when cannabis is legalized, if the voters ratify the constitutional amendment. So you'll see that a personal amount is still the same and a civil use amount is still the same. However, a person may possess cannabis that does not exceed 1.5 ounces, and they may also have 2 or fewer plants. So it authorizes home-grown amount of 2 or fewer plants per household. Even if there's 2 or more people living in that household, we'll get to that eventually, it's still going to be limited to 2 plants per household. You must be over 21 to possess legal cannabis in an amount of 1.5 ounces or less, or no more than two plants at your house. And the fines are all still the same, but there'll be no fine, of course, if you're over 21 and you have less than 1.5 ounces. Going forward, if you're an individual who's 21 or under 21 years of age, though, you could get fined up to $100 if you possess cannabis, period. And the civil fines remain at $250 if you are within the civil fine range. And again, the penalties for possession of more than a civil amount will say it's 6 months imprisonment or $1,000 fine. And I'll point out where it is, but under current law, that would be a felony. This bill changes that to a misdemeanor for possession in an amount greater than a civil fine.
What's the penalty for more than 2 plants?
More than 2 plants, that's coming up too. There's a special provision about penalties for more than 2 plants.
Thank you.
So on page 6 is that section of the law regarding simple possession and the definitions will look like post July 1, 2023. If you go to page 7, most of these changes relate to the fact that it's going to, you're going to have a personal amount that's legal. So all these are just consistent with those changes. There's nothing really being added here. The smoking in public is still maintained at $50 for the first offense and $150 for a second offense. If you go to page 8 of the reprint, numbered page 8, this is the cultivation provisions. So again, you're limited to only 2 plants per household. You have to keep it out of sight. You have to use reasonable precautions, lock space. The person who cultivates shall take reasonable precautions to ensure the plants are secure from unauthorized access. It may only occur on a property lawfully in possession of the cultivator. Again, you have to be 21 years of age. You may not cultivate more than 2 plants. The penalties for that are in the middle of the page, subsection G. A person who violates this section is guilty of a misdemeanor and on conviction subject to imprisonment not exceeding 3 years or a fine not exceeding $5,000. So if you get caught growing more than 2 plants, it's a pretty high penalty. The next page involves adult sharing. So, when there's going to be retail sale, that's going to be different. But if somebody grows some cannabis and they want to share it with somebody, this covers that kind of sharing, provided you don't share it with somebody who's under 21. And if you violate that, yes, and so the section does not prohibit, and there's no civil or criminal penalty may be imposed for adult sharing of the personal use of cannabis. The next page takes you to, and this becomes effective, this next section's become effective on actually January 1st, 2023. So the remainder of these provisions, and this also includes the provisions relating to expungement, actually take effect January 1st, 2023, should the voters ratify the adult use of, or the legalization of cannabis. On top of page 9, these are just conforming changes to the juvenile causes law. Wherever you see marijuana in the code, it's going to be changed to cannabis. On the bottom, we're back again to the criminal law article regarding CDSs. Here, a definition of cannabis is established, and you'll see what that is on the middle of the page on page 9. And if you go down, there's a whole series of definitions and provisions regarding paraphernalia. Since cannabis is now going to be legal, anything that is paraphernalia other than cannabis will still be under the same provisions, but if it's cannabis related, it will not fall under these paraphernalia limitations in the criminal law article. And in fact, you repeal specific references to paraphernalia as it would relate to cannabis under the law. And that's on the bottom of page 10 through page 11. If we go to page 12, numbered page 12, these involve the current civil use for simple possession of cannabis. And again, it's, we're talking about those who are in possession of a civil amount here, which is the 1.5 to 2.5 grams. And again, so wherever you saw a reference to the current state where it's less than 10 grams of marijuana, now it's going to be the civil use amount, which is 1.5 to 2.5 ounces. Hopefully I'm making sense here. If you go to the next page, again, these are more conforming changes to the fact that it's going to be cannabis and not marijuana, and this whole section is dealing with the civil use, not the personal use. Let's go over to page 14. This is, at the bottom of the page, this is the section that deals with intent to distribute, and I think we just discussed that if you're over the civil amount, then you could be subject to a misdemeanor, not a felony. That's in this section here. And you'll see that on the next page, on page 15 in the middle, where it says that this is a misdemeanor, not a felony. And there are additional restrictions here. There's language in the bill about manufacturing a controlled dangerous substance. Well, they've also added a whole provision on page 15 about if you may not cultivate, grow cannabis in a fashion that would indicate that you are going to violate the 2.5 ounce limit. This again will not apply to the retail sale, of course. This only applies to an individual's attempt to do, grow in their home or something like that, or manufacture items in their home. So, let's see, again, if we keep going to page 16, this is more conforming changes to the law because of the fact that you have a personal use amount that's legal and a civil use amount that will be subject to a civil fine. On top of page 17, this is new language. This is not in the House bill. This was added by the sponsor. And this has to do with an open container requirement in a vehicle. Currently, there's provisions in the law that govern, at least in the criminal law, that's 17. There's provisions in the law that govern open containers of alcohol in a car. So this adds cannabis to those provisions, and you'll see how it's structured here. First of all, on the top of page, cannabis is added as a definition. If you go down below, the actual operational language here, it says that an occupant of a motor vehicle may not possess an open container that contains any amount of alcoholic beverage or smoke or consume cannabis in a passenger area of a motor vehicle on a highway. That's important, as I've learned here. That's a very important distinction. You have to be actually driving for this to apply. If you're parked or you're, somewhere else, then this provision would not apply. The driver of a motor vehicle may not be subject to prosecution for a violation of this subsection based solely on the possession of an open container or possession of any amount of cannabis. So it puts cannabis in the same format as alcohol. So you can't, it can't be, and again, this is not my area of expertise, but you may not be subject to prosecution for a based solely on this section. And there's exceptions here that if, say, you're in a motorhome vehicle, you're in a limousine, people would be drinking in a limousine. Although smoking cannabis is a little different, so there's a breakout here that says an occupant of a motor vehicle may not smoke cannabis in a passenger area of a motor vehicle on a highway. It doesn't allow these folks to smoke cannabis in a bus, taxi cab, or limousine. Only the smoking of cannabis. If we go, you can't smoke cannabis anywhere in a motor vehicle while it's operating on a highway.
Even a bus?
Even a bus, yes. That's the design of this. That's the intent of this. Or a motorhome, yes.
Quick question. You kept coming back to the word highway.
Uh-huh.
Does that constitute all roads?
Yes.
Okay.
As long as you're driving down something, that comes into play. Okay,
Before you move on, please, going back to bottom of page 17, 10-125, except as otherwise provided in subsection C of this section, an occupant of a motor vehicle may not possess, this is going back to your open container, an open container that contains any amount of an alcoholic beverage or smoke or, and then it says consumer cannabis.
I probably left that out in my rush to get this ready. It should say,
Typo.
boy, I messed that up completely. Yeah, okay, I'll fix that.
Oh, okay.
And I think I may have to do something about this cross-reference here, but I thought this was, I have time to make some of these technical or drafting error changes, so I'm gonna work on that section there, and I certainly completely screwed that up.
So, all right. But then, so where you can't consume or smoke
Yes,
is what we're saying.
yes,
No edible.
Exactly.
yes,
In a motor vehicle.
yes, while it's moving.
While it's moving.
Yes.
What about the passenger consuming?
Well, that's dealt, okay, so this is the.
It says occupant,
This is an occupant, yes, yes.
so that's anyone in the car.
Yeah, then we talk about, under 2, you talk about the driver, and then, I think subsection B talks about passengers, so I'll make sure this all is I threw this together about an hour and a half ago, so I'll make sure it's all right.
Section for me, when we get it finalized to really look at closely, thank you.
One of the many Kramer insertions into the bill.
Okay, so, let's see, where are we here? Okay, so now we're on 18, we're on criminal procedure, so we're out of the criminal law article. And these are just conforming changes to the pre-trial procedures. Again, you're replacing marijuana with cannabis and referencing the fact that you now have a civil use amount. So that's what all these are about. Otherwise, there's no changes to the pre-trial provisions of the law. Bottom of 19, this begins expungement under criminal procedures. So, again, consistent with the changes, post ratification, there are changes made here, again, because it's no longer going to be marijuana, it's going to be cannabis, and they have specific provision, or specific changes to the current provisions regarding expungement as it would relate to marijuana or cannabis. And the middle of the page, you'll see new language here, and this would institute a procedure for releasing an individual who is incarcerated if they were incarcerated solely for simple possession of cannabis. But they would have to follow this process set up under 10-105.3. The next section deals with petitions for expungement, and again, these changes are conforming to the current, would be the current state of the law post-legalization. And so those are appropriate changes on the next page. I couldn't begin to tell you what all these are, but. When you say next page, where? 21. They just, they take marijuana and put cannabis in there. And these are, I guess, all the items you could get a, petition for expungement for.
We drop back to 20 real fast and tell me, have we begun to address, because under current law, you can't expunge the DUIs. What's going to happen here where you have impaired driving that is related to cannabis?
I don't think this goes into that yet. So.
Okay, so we haven't, because I'm looking quickly at, charge for a minor traffic violation or possession of cannabis. And I see it's going into 5601 of the criminal law article, which I'd have to pull to take a look at what it addresses. But.
Well, that's simple, 5601 is simple possession.
Is simple possession?
Yes.
Okay, so perfect, okay, we haven't gotten there.
No.
Okay.
I'm not sure they've gotten there. I'll have to look, but I didn't see any reference to expungement for impaired driving regarding cannabis. If you go to page 22, and this is a specific provision for expungement for intent to distribute. So you could, after a certain period of time, after 3 years, you could petition for expungement for intent to distribute. The middle of the page, Maryland Judiciary Case Search, after a certain period of time, if you were in possession of cannabis under simple possession, that would not show up on the Judiciary Case Search. I forget what it's called, but you could, if you search somebody's name, that would not show up for a charge that was disposed of prior to July 1st, 2023. The bottom of the page, this is mandatory expungement by the courts for possession of cannabis under 5601 of the criminal law article only. So again, it's all only for simple possession, and the charge was issued prior to July 1, 2023, which is the date cannabis would be legal. So the courts would be required to go through and expunge all those records, all those cases for simple possession prior to the legalization of cannabis. So that ends the foray into the criminal procedure and criminal law article under this bill.
Hey, during the hearing, and I might have missed this because I was paying attention to other parts of the bill, we had talked about the time frame in between, like, the results actually being certified and when something go in
Yes.
law. Are there still criminal penalties attached, or is that all civil citation?
The way it's envisioned, and again, the latest you can go without having, with the results being certified would be January 1st. Presumably, it could happen before that. But it's designed to create a format from January 1st through the legalization where you have the civil and personal use amounts only subject to civil fines. So if you're, again, over 2.5%, if you're over 2.5 ounces, you're still subject to all the provisions related to intent to distribute. But if you're under 2.5 ounces, you would only be subject to a civil fine for that 6-month period.
Right. And when to become legalized, is it the standard consistent?
The standard would be the same, yes. If you're under the personal use amount, then no problem. But the civil use amount, again, would be 1.5 to 2.5 ounces.
Right. So let me
Going
say,
forward.
let me say it differently, and you could correct me if I'm wrong. So between the time frame of when the results are certified and the law is enacted, if you have below 2.5, which is defined as personal use, it would be a civil penalty.
It would be only a civil fine, yes.
Anything above 2.5 would still
Intent to
have
dis-
some criminal procedure.
Yes, would still have some criminal procedures.
Got you. And then once this is enacted and is legalized, it would be the same. Anything below 2.5 will be a civil penalty. Anything above,
But anything below 2.5 and above 1.5 would be civil. Because under 1.5 would be legal. So there's no, you couldn't be arrested.
below 2.5 and above 1.5
Yes, ounces, yes.
would be civil.
Would be civil, yes. Forever and ever until you decide you want to change that.
Got you. And so 1.5 is pretty much the standard by which is just,
Yeah.
you good.
Yeah.
Okay. All right.
You made the point, and I made the point at the hearing, which was specifically that what happened in New Jersey, you had the referendum, and there was a much longer
Thousands
period
of
before the
arrests.
governor signed the bill, and then you had a lot of 6,000 arrests specifically in that small possession category. So here, by making January 1st, all this under 2.5 basically becomes civil, I think you're addressing the bulk of the New Jersey problem. I mean, that's at least the intent. So, you know, you're not waiting till July. You're getting it civil under 2.5 basically from January 1st anyway. But
No,
that
got it.
was
Thank you. That's
yeah.
helpful. Thank you both.
Okay.
Can I ask a question on automatic expungement? Have we done this, for example, when we legalized gaming? Did we do this?
I don't believe you did, no. No, you did not.
So this is automatic expungement for just for the possession charges, not for,
It's for simple possession, yes.
so for PWID, for possession with intent, it's up there in the bill, right, that they'd have to, after 3 years, they could apply?
Yes.
3 years after they finish whatever, and for anything worse than possession with intent, then this bill doesn't give them any
No, no,
expungement
it
path,
does-
it's not already in law.
Whatever existing law applies to that would still apply.
I'm generally okay with that. If we're gonna legalize it, getting rid of expungement, I getting rid of charges in the past for possession. I'm not really, just
And
not out about the overall issue, but.
And apparently the House is, this obviously has got a cost associated with it, and the House is also, apparently there's money in the budget again for that purpose, for the judiciary to, initiate this process.
Right.
Okay? All right, so we're now back to the bottom of the page 22, and we're now in the Health General article. And this establishes the Cannabis Public Health Advisory Council. So you go to page 23, and it's your classic advisory council established in state government. There's members designated, chairs designated, the duties established, and what it's supposed to do. A good chunk of the members are various state officials, but then if you go to the middle of the page, you'll see other folks appointed by the governor, somebody from the Governor's Office of Crime Prevention, Youth and Victim Services, representative from an HBCU, a healthcare provider with experience in cannabis, a pharmacist licensed in the state, on down for various experts in the field. At the bottom of the page, you'll see there's the traditional diversity and geographic representation language. On to the next page.
Don't see any representatives of the legislature on here. Am I correct in that?
I don't believe so, no. There are no representatives for the legislature.
And this is the Public Health Advisory Council.
This is a Public Health Advisory Council in the Department of Health, yes.
All right.
Also, no one from the industry is represented here?
Let's see. I don't see one. Well, there is no industry yet, but no, I don't see one from at least, I guess, if you consider a laboratory to test cannabis an industry, there's somebody from there.
Not really. But, okay.
Yeah,
I
but
think
no,
we-
no, there's nobody from the existing, at least nobody from the existing medical cannabis industry.
Right.
listed there.
Anybody from the growers or processors or?
No, no.
Nothing like that yet?
No. Let's see, okay, we go to page 24. These are the, if you, on top of the page are the terms of the member. They serve 4 years. The chair will be elected by the members of the advisory council. This is all classic language regarding when they meet. They have to have a quorum, can't receive compensation. At the bottom, you'll see more specifically what the advisory council is charged to do: promote the promotion of public health and mitigation of youth use of, misuse, and addiction to cannabis, data collection, reporting, the impact of cannabis legalization on the education, behavioral health, and somatic health of individuals under the age of 21, and initiatives to prevent cannabis use by individuals under the age of 21, public health campaigns, advertising, label requirements, training for healthcare providers related to cannabis use, best practices, et cetera, et cetera. In the middle of the page, there's also established a cannabis public health fund. The purpose of this fund, this is also another special fund, it's non-lapsing, and it's to basically fund the activities of the advisory council, and the money is appropriated to the state budget, and money from any other source. It may be used only to support the advisory council, and you'll see these items are very similar at the bottom of the page that I just read regarding the duties of the council. And they will be required to report to you its findings and recommendations annually on or before December 1st every year.
I think he's
So
not done
that's
yet.
the Public Health Advisory Council and Fund. In the middle, or starting on page 26 and on the next several pages,
Wait a minute.
some of you may remember the indoor smoking ban.
Yeah, okay, I want to get back to the advisory board and follow up with what Senator Hershey said. I'm on an advisory board for problem gambling, and we include all of the casinos. I think when you have an advisory board, you need some of the people that are directly involved with the item that you're talking about. I don't know, maybe, and I don't know who that would be. Senator Feldman, you're looking at me like I have two heads.
Yeah, and I think, David, we don't have we have a medical industry, but we haven't moved to a full-blown market structure. So when you talk about the industry, you're talking about a pretty small, we don't have a legal industry yet beyond the medical, so I'm not, if you're only talking about, it would only be currently, until we actually pass the referendum and pass a, bill that creates an industry, that I think might be the part of the problem. We have a medical industry. I don't know. I'm open for ideas.
No,
you think
I
we should have
just,
some?
just think that, the people that are directly involved aren't at the table. But I guess if we don't have anybody, well, the growers and the producers and the sellers.
If you want to add somebody, again, it would be the medical folks, because there is no adult use legal industry yet. We don't have that in place yet, Marilyn.
Still growing.
Okay, well,
No,
if
I
you want
don't
to
know.
add somebody, that's fine.
Okay.
We just, yeah.
Okay. Let's go to page 26, and some of you may remember the Healthy Indoor Air Act, or the indoor smoking ban, as it's easier to say. This brings in that part of the law and adds cannabis to those provisions. So basically, where you can't smoke tobacco indoors, you won't be able to smoke cannabis indoors either. It's basically the intent of bringing them in here and applying the same provisions. And that would carry well over to page 28. At the bottom of page 28, this is from Senator Hayes, and this is the Community Reinvestment and Repair Fund that was actually in Senate Bill 692, and it's transposed into this bill, and this would, It requires basically money to go straight to the local governments as distributed by the comptroller based on criteria established by, or determined by the Office of the Attorney General, primarily for communities that have been impacted by the, I guess for lack of a better term, the war on drugs. And for this group, it says fund will consist of revenue distributed to the fund based on revenues from adult use cannabis. There was no need to get any more specific from that because there is no industry yet, but this just, eventually, when you establish an industry, you're going to develop a tax structure, and so the fund will get a large chunk of its monies from there, which was anticipated by Senate Bill 692. Also, money from an assessment on the licensed medical cannabis growers, processors, and dispensaries is determined by the Cannabis Commission, and any other money from any other source accepted for the benefit of the fund in accordance with any conditions adopted. That's standard language that you add to any special fund.
Did you say the medical licensees are paying for this fund?
A portion of it, not all of it. I would imagine eventually most of the money from the fund will come from the from taxation of the industry.
But why would medical processors and growers, why would that industry pay for this one?
If you remember at the bill hearing, we had a whole conversation about eventually, when we get to the licensing issues, one of the ways that you would potentially get a dual license, like a medical processor or dispenser or grower, would have to pay a big fee. In my bill was to go into basically to a fund for the right to apply. That would be part of the application. So in this sort of mechanism, we're taking that, whatever that money potentially would be. Again, this will have to get played out next session when we create a market structure. But I guess what's envisioned here would be amongst the other sources of revenue for this reinvestment fund, repair fund, folks who want to apply to try to get dual licenses, that money could go and would go into this fund to get re-siphoned back to local communities. You got to fund it somehow. So yes, some portion would come from tax revenue, portion would come from folks trying to get from medical into, and then any other source that we can come up with.
So they would be getting something for it. I mean, the way it says right now, the money would just come from the assessment on the licensed medical cannabis growers process.
I mean, we'll have to work on that potentially again next session, but I think what's envisioned is that would be similar to what was envisioned in the original bill, which is if you want to attempt to get a dual license, you're going to have to pay a big fee. Right. And so we don't spell it out here, but I think ultimately that's kind of, we'll have to flush some of this out when we get to market structure.
You don't envision them just paying an assessment and not getting anything for it?
Again, we don't have an application process for these folks. Again, we're not taking that up in this bill. Okay. So, I think there are some issues here we're going to have to hash out when we get to the point of actual licenses into the adult use market. Right. So this fund in particular is not going to kick in until such time as there's a market structure. I mean, if you look at the first, it's revenue from tax revenues that don't currently exist. So I think this is a 2023 conversation about how this will.
That's why I was concerned, because since there is no tax structure yet, and it says that you can assess the licensed medical cannabis growers, you could do that immediately.
Right, but this fund is not kicking in unless, number one, the referendum passes, and number two, we have a market structure. So unlike the other one, the other fund, which actually has an appropriation this year in this year's House budget, again, it's not been finalized. So one already has been budgeted. This has not been budgeted. It's an idea came from Senator Hayes and Senator Carter to send back money to the locals. And that most of the money will come from some portion of tax revenue, but there should be some other sources can fund this particular idea. So I don't think I can go beyond that until such time as we would hash out the details of, that whole licensing regime and the idea of dual licenses and all the rest. So.
All right. My only point, I didn't want to see that this is the seed money to start this fund through licensing. That's not the intent.
There's no money in this fund, this particular fund in the current budget, so this would be a fund we're creating now, setting up now. As I understand, I'm going to defer to Senator Hayes. He may have some different views on what I just said, but this was an idea that came from him and Senator Carter, so.
Thank you, Mr. Vice Chair. The difference between this fund and the other two funds is it's to benefit those communities that's obviously been disproportionately affected. Obviously, there's individuals that's been arrested, but the communities from which they come from, and from my point of view, specifically black communities that they've come from, has been disproportionately affected. The previous fund, one is to benefit some business owners so they could get, you know, some additional revenue. The other one is to deal with some really serious health issues as a result. I think this fund is unique in that it provides an opportunity for those communities that have been disproportionately affected by what we call the so-called war on drugs. If even, you know, and the vice chairman is right, it doesn't take effect until there's actually some type of industry realized. But as we know, and from experience, we're still trying to address the inequities that was created by the medical marijuana as well. There was some issues there when it was created. And so we're still not at a point where the industry actually looked like, you know, the diversity that Maryland represents. But that's neither here nor there because this is, you know, one to study. But there can be an argument made to levy resources from the medical industry as well.
This conversation?
Oh, I'm sorry, I forgot the chair wasn't here. Senator Augustine.
No problem.
Sorry.
Yeah. I'm gonna tell you, I kind of agree with Steve. I don't necessarily see why the medical folks would be in this. I just don't. But I will say this, though. In the other bill, this tax revenue, I think it was 25%. I would look for this to be at least the 30% of the tax revenue, at least 30% of the tax revenue. Did that be a part of that number one?
Okay.
Such that we make sure, like we talked about, you know, I'm trying to just put some more guardrails on since we're trying to sort of stay away from them. I at least want to feel better about that guardrail as far as making sure that this revenue is going to go back into these communities that have been really hit hard by this.
Okay, any other additional, Senator Hayes?
Only
As we
thing I would
flush this
say
up.
to my colleague from Prince George's County, you may have the luxury of not being here when this medical marijuana industry came together. But I did, and I saw the games and tricks that was played, the intentionality of those to establish it and making sure that communities weren't included. And so I stand by what I said, and I think that it's, you know, important, especially as we go along. There is no doubt that those who are in the medical marijuana industry will be one of the first in line to convert into the recreational marijuana. There's no doubt. They already have a undue advantage in competing in this process. And so there should be something that's assessed in making that transition from medical to recreation.
Well, Senator, that was part of the reason why I didn't actually want to put them in here. Because by putting them in here, you are saying that they're going to have that unfair advantage, that they are going to automatically get something in the adult space, and I'm not ready to commit to that. So if you're, that's where it really was where I was coming from, that I don't feel so comfortable saying just because they're in medical, we automatically should put them to the front of the line for adult use.
No,
But that's
agree with that.
But that's the implication. And that's my rationale for saying now, they got nothing to do with this for now. So that's where I was saying, to me, they should not be in here, because if you put them in here, that's what Senator Hershey was talking about. Well, what do they get for that?
Right.
Are they going to get for that a share of the adult? That's just my thinking, Senator. That's
No,
the reason.
Yeah, and I hear you loud and clear, and thanks for that explanation. But, you know, I still stand by, they already got what they were going to get. And I hear you, you don't want them to jump to the front of the line, and maybe we could talk some more about that, but, they took advantage of the processes and the system that we have here
I hear you.
already.
Okay, well, I guess we'll take this up a little bit. I think this is an important issue. And again, as far as front of the line, back of the line, those are issues that we will take up next year. If, either you want to have as many players potentially funding this or not, but the line issue is a topic for not this bill. And having them in here funding this program does not preclude us when we get to market structure, taking the position they should be here or there or nowhere. So I don't think it prejudices that conversation to have them in here, but that's just my opinion, but I hear you, where you're coming from. Senator Reedy?
Are we done going through the bill, or we still have more?
No, you got a few more things.
Oh, that's fine, I'll
Yeah.
wait, I'll wait.
Okay. Dave?
Okay, so to the bottom of the page, in page 30 is Senator Hayes's fund, for lack of a better way to refer to it. The next couple of pages are struck from the bill because, as envisioned, the senator's bill had a whole industry structure established, and there was going to be a tax structure to tax that industry. That's all gone. So let's go to page 33. And instead, the senator is proposing a subtraction modification for the existing cannabis industry for certain expenses under the tax law. And he can go into more detail about that. This is basically Senate Bill 333 that's been added to this.
You say existing. This is for future also. In other words, we have businesses, state legal businesses in our state. The only industry, and it's not the current, it's future licensees too, that cannot deduct their ordinary business expenses is this industry. Other states can't make it. It makes no, honestly, if we're going to have legal businesses in the state, which we currently do and hope potentially will have in the future, those folks should be able to deduct their salaries, their business equipment, their rent, like everybody else. And so this is the so-called 280E issue, federal law. There is a standalone bill over in the Senate Budget and Tax Committee that was likely to move out, and I thought that it should be incorporated into this. I think it makes sense.
This ought to be amended then.
What's that?
This refers strictly to the medical cannabis, so we'll have to change that.
Yeah, I mean, what I'm intending is that this should be in Maryland law for legal businesses in the state of Maryland that are in this industry. So I don't know that it's limited to, in my view, it shouldn't be limited to the medical players, but should be, in perpetuity for
It'll be
all
changed.
players. I can't think of why, one group would be entitled to it and everybody wouldn't be entitled to it, so,
It'll have to be clarified.
yeah.
Okay. If you go to page 35, and you'll see the large part of 35 is struck. This was in the original bill regarding rules of the road, and that's all taken out. But consistent with the language we talked about in the criminal law article under Title 10 regarding open containers, there is a rules of the road regarding impairment. I'm on page 36. So there is also restrictions, of course, about consuming alcoholic beverage while you're operating a motor vehicle. And this would add cannabis to that restriction on consuming alcohol. So you'll see there's a series of definitions, and again, this is the rules of the road, driving while impaired. A driver of a motor vehicle may not consume an alcoholic beverage or smoke or consume cannabis in a passenger area of a motor vehicle on a highway. So again, this dovetails along with the open container prohibition under Title 10. You pretty much need both here to make this complete. And again, you have to be operating the vehicle on a highway for this to apply.
A quick question about that. I know we're talking about cars, and the issue was like limousines and buses that, you might have a party van that they're drinking in the back. It's not affecting the driver, so we're going to take cannabis out of it. what about aviation? And I know you know, you can't smoke it, but I think the question was asked earlier about the edibles. Do we have to worry about aviation or,
I mean,
Train.
on a plane,
yeah, I mean, you have corporate jets coming in and out and they're bringing food on, they're having, you know, catered service for the guests that, you know, they have brownies and.
I
you know,
don't
they're gonna
think
feed the
we've got,
pilots.
I don't think anybody has gotten that far yet. Plus, I believe you're also allowed to drink on a plane, so. Well,
Yeah, but no, they are, but like, here's where I'm coming at this. I believe they have brownies as an edible, correct? You get on a plane flies into Martin State to pick up a couple executives for, you know, a corporation to fly them out. And, you know, usually a company will deliver food for the flight for them to enjoy.
I don't have
And,
an answer for this.
you know, the flight deck, they get tired, they get hungry, so they might call back and say, hey, bring me up something to eat.
Going to page 36.
I mean, I'm digging deep, but it's a possibility.
The possibility too is people are already doing it, but they're doing it right before they get on the plane and so, but you have a different
It was
kind
just a
of
question.
thought. Yeah, well, it's a very valid question.
It's the edibles is what I'm worried about.
Yeah, but I know a lot of people that do the medical marijuana and they like to take them to relax them and to make them sleep, and they'll take a pill or they'll have the edible before they get on the plane, so.
Senator Benson?
Yes, I want to get back to the mobile, the home, you know, the little mobile homes. So if we go camping, Honeybee and I go camping, we can't smoke.
Well, the vehicle's on the highway, no.
But
Well,
if
it's
it
moving.
parks,
If it parks, then that's different. That's not on a highway. There's a lot of case law regarding this kind, well, again, a little bit beyond my knowledge, but my understanding is there's case law governing when the car is parked versus when it's in motion. And the intent of all these laws is the car has to be in motion.
so back to Honeybee and I, we're riding along, and we have two couples that, a couple that decided to go with us. And the couple decides that they were going to smoke a little cannabis.
The goal here with this language is to say that if the car is moving, you can't be smoking cannabis in the vehicle.
Okay, thank you.
David, when the wheels on the bus go round, smoke.
If I can interject here, because we do have open containers even if the car is parked, and it does read, this section applies to a motor vehicle that is driven, stopped, standing, or otherwise located on a highway. So we're using the same, it's applying the same principles that we have for open containers.
For alcohol.
For alcohol.
Not, yeah, open containers, I think, is dealt with elsewhere in the criminal law article. This is for consumption of alcohol.
Okay, then this is comparable then to,
It's intended to be comparable, yes.
correct, okay. So it does apply if you're pulled in and sitting in the 7-Eleven parking lot and toking. With
So-
the likelihood you're then going to be driving the car while you were immediately following.
Okay. So let's go down to, the next pages are all struck.
Senator Reedy, sorry about that.
Senator
Sorry.
Jennings' point made me think of something I wondered about when I looked at the issue with driving. Are our boating laws the same as the driving laws? I think they are for drinking and boating. Is like this, is it in the same section? Are we making sure,
I don't know where they are. They might be in boating might be covered under DNR. I'm not sure.
Okay.
We haven't, that wasn't brought up, and I think all possible circumstances have been considered yet, but.
well, I know it may seem a little bit like, pedantic, but high-speed boats going around, cause problems. That's exactly what I had in mind. but, there's a famous case, but not just the one, I mean, in all seriousness, I mean, we should look into that is all I'm saying.
Yeah, okay.
Okay, so the special sections in the back are all struck in lieu of new special sections that are added. And again, a lot of this, Senator Feldman's bill did have a constitutional amendment embedded, and that's all struck from the bill, and that's what you see here up to page 38. So the sections here are added, the middle of page 38, this is your typical language regarding the staggered terms of the advisory council. So you want people to come and go, not all at the same time. You want them to phase in and phase out. Also, there's a lot of concern about who's going to be regulating this upcoming industry if the voters ratify the Constitution and legalize cannabis. So this language start on the bottom of page 38 through page 39, the top of page 39, starts the process of combining the Cannabis Commission with the Alcohol and Tobacco Commission. So they would become one and still maintain, the hope would be they would still maintain all their existing responsibilities, but they would become one commission regulating all of cannabis in the state, rather than you'd have a separate cannabis commission looking at medical cannabis, and then the Alcohol Tobacco Commission looking at legalized cannabis. They would all fall under the same regulatory commission. So this starts the starts the process of transferring pins to one commission and making sure nobody gets hurt when they get moved to a new commission and things like that. Section 9, to the bottom of the page and on the page 39 to page 40, this is the disparity study that would be required before you could establish an industry and then put in specific preferences for certain types of businesses that would help them enter the industry. This was the same language, or it's very similar language that was used in 2017 for the disparity study for the medical cannabis industry. It was developed by the same people. So it's far more comprehensive than the disparity language that was in the bills introduced, and this was also in the House bill. So before you even go down that road of establishing an industry and then putting in preferences for companies that could be owned by folks who are disadvantaged by the current state of affairs, you would need a disparity study to avoid any constitutional problems associated with that type of preference.
A question on that. So I'm reading that, and I asked this question in the hearing. I see the disparity study, but can you point me to the trigger from the disparity study that we won't create industry or anything else like that until this is done?
The one, you don't have an industry, right?
I say create
So this,
to be able to even.
this disparity study has to be completed prior to, I believe,
Now, they give a date, but it's not a real date. I mean, so they don't make the date because they're not going to. Having spoken to the people who have responsibility for this, it's going to take longer than what we've put here. They're not going to do it, okay? So they don't do the date. Do we have any protection in here that says we do not start building this industry until this disparity study is done?
I guess if the protection would be that, you have to come back next session to start that process, and then if you don't have this disparity study.
I would absolutely look to have some language in here that creates, I would like to figure out a way to have some sort of a protection that the disparity study is complete, that we're done with it before you start trying to build a new industry.
I guess one of the, it raises kind of a question. So first of all, next January is we'll have a different legislature here making these policy calls. I'm not sure, we'd have to think about that. I don't know exactly if we can bind some future legislature in 2023 to not pass a bill in this space because of the prior legislature says you shall not pass laws, and I don't know if that's even legit. We'd have to kind of think about that. I mean, that's what you're basically saying is, in 2023 session, you know, the Finance Committee cannot pass a market structure bill because the prior Finance Committee told you can't pass the bill?
What
I
I
don't know.
said is a trigger
Yeah.
to start asking, you're asking folks in here to start, and maybe we do that way. So if we said that we're going to depend on the alcohol, you know, this new entity or the
Maybe
commission.
that, you remember I gave you, I think Antonio and you, I gave the number, I talked to her today from the AG's office,
spoke with
Anita.
her.
Did you run this particular issue by her?
Yes, I did.
And what did she say?
She said, she
Yeah.
didn't see where this was, you know, this was gonna be a significant process.
Right, so
So
she.
we talked about the
Yeah.
fact that it's gonna be a significant process. What I shared with her is my concern is what Senator Hayes was talking about. So it's not that I don't have those concerns, Senator Hayes. My concern is that we pass this, the disparity study is not done. In January, everybody's jumping up and down because it's gonna be legal in July. We're gonna give adult use licenses to existing medical marijuana folks, and I'm just not here for that. There needs to be a protection that says that when this industry is built, that it's built with full information that includes the disparity study. Otherwise, the folks who, we just went through this with sports wagering, same thing. Now, we pass it, we say we're gonna do all these great things, we pass it, but now, well, everybody gets all up in arms, we gotta have betting. So what happens? The casinos end up with a head start, and the other folks who thought they were gonna be getting into this business, they got no shot. Or they're way behind. I am saying that this disparity study is a central part to creating a fair, level playing field, and we gotta figure that out in order for me to be feeling good about supporting this.
Okay, so we can agree, because the intent of this, obviously having the language in here, is to make sure that we're on some sound constitutional ground as we move forward. We don't want a bunch of lawsuits that have merit, because right now, we're stuck on 5-year-old disparity study done.
I'm in agreement.
You know, like that would be, I think, somebody described, it would be laughable for us to base whatever we would do in market, social equity and otherwise, based on a, 5-year-old study. So we definitely, absolutely need to refresh this with a new study. The question of timeline,
that.
I'm not equipped to know. I honestly don't know how long that would take. You're saying, I mean, here we are, that part of the bill, Dave, correct me if I'm wrong, kicks in,
Well, it says here you have to have it done by
November.
November, yeah.
okay, so November before. I mean, that's what the bill says. You're saying that you're quite certain there's no way we can do it by November? I mean,
Well, if you
starting
remember-
today or tomorrow?
I mean, you don't have to depend on me.
No, I'm asking.
Mr. Tilburg came in here and that's what he said, if you recall.
Mm-hmm.
He said, if we were just doing a refresh from the 2017, he felt like maybe, but then he said, if you were trying to get all the data and all that stuff, that it was gonna take longer. It was gonna take a significant amount of time. That's what he said.
I mean, I do remember him saying it, so I can't challenge you. Okay, I guess we need to get a better handle before we think about binding future legislatures, whether that's even legit. I do think we need to get a better handle on really realistically, like how long does it take to do a study? And can you say that,
I'm
you know?
okay, I'm okay
yeah.
with that, but again, I
Yeah.
would just suggest that whatever, if there is a way for us to have a trigger of some sort or something, you know, like, to me, and I'm also not suggesting, Senator, that the legislature can't come in here next January and undo what we did. But guess what? We will have at least done our part. And they can try to come and undo something, but we can do our part to try to create something that's fair.
Well, I'm
And
hoping you'll
that's
be
the-
part of that next session. I hope we all
Well-
are part of that next session. We can recall this.
We hope so.
Okay, Senator Hayes, I mean, look, these are important issues. and
No, I think Senator Augustine
yeah.
said it well. I think, to your point, Mr. Vice Chairman, we bind future legislators all the time. Whether it's pre-authorizations in the budget or other legislative language, I think for us to feel, any level of comfort with it going forward, it should be something that's in writing that says this has to happen until these other things happen.
Okay, I mean, again, the one check and balance is the legislature, then, hopefully it'll be a majority of us, you know, would know what the risks of moving forward to just pass stuff without, but okay, I hear you loud and clear, so let's ponder that. One of the reasons we didn't jam anything out here is to put everything out on the table and try to figure out, you know, what needs to be modified
And
here.
I'm really glad that you put the disparity study in. I mean,
Yeah.
that's great. Like, I'm all for that. It's just, I know, I sense, based on the past, the pressure
Yeah.
that people are gonna feel. Man, can you imagine the pressure come November? Like, it's just gonna be unbelievable, Senator. And so that's where I just feel like we really need to try to do
Okay,
something.
let's brainstorm a little on this.
Right, no, the
Yeah.
only thing I was gonna say, I didn't talk to the AG's office specifically about this, but in the amendment that we proposed around renewable energy, they felt that a difficult timeline to have anything done in the fall, that the best that they could promise me was sometime in January or February, given all of the other demands that they have, and so it's very realistic. I don't think this Verity study as relates to the medical marijuana was produced on time, if memory recalls. So I think he presents a very legitimate point that we should figure out some language to add to
Okay, well,
this.
let's brainstorm between now and tomorrow, and maybe Dave get some ideas, or maybe we'll talk to the AG's office, what's possible, I don't know. I mean,
Well,
any general thoughts?
Generally speaking, you can't, depends on how you want to structure your licensing going down the road. You wouldn't be able to do the preferences you want in the law to aid folks who have been disproportionately affected by this without this disparity study. So you need to study before you proceed, you know, I would imagine you would need to study before you would have the support for any licensing structure. That would also include what you're looking for those types of folks who are trying to get into the business. So the study has to be done.
I agree, I just don't trust that. I hear what you're saying. Yeah, very supportive of the study. We want the study. It's just, the study should come first. That's all. Just the study should come first and try to create some protections.
Talk to an AG.
Put the November date in there for that purpose, but if you're telling me that you have, you know, from Mr. Tilburg's testimony or others, that may be unrealistic, we'll have to, let's try to figure that one out. The intent was to do exactly that, but, okay, let's keep going here.
Okay, so only a little bit more here, and most of it's technical. So if you go to page 40, you'll see that there's an additional study required of the Cannabis Commission to study possibly a home grow program for qualifying patients. This is all medical cannabis. And then there's an establishment of on-site cannabis consumption facilities and methods to reduce use of cannabis by minors. A lot of this goes along with the study by the commission, the advisory council. The bottom of the page, section 11, is strictly technical, makes necessary changes to the code that weren't envisioned by this bill. Section 12 is all the effective date changes. So you'll see that a lot of the sections that were just discussed, except for the beginning study, I can't remember what it was called now, the cannabis baseline study, except for that, which would start immediately upon an enactment of the bill. All the other sections don't take effect until the voters ratify the legalization of cannabis. And let's see what else. And then you'll see an interesting little tidbit here on the top of 41, section 13. This deals with that 6-month period where you have civil fines for personal and civil use until it's actually legalized on July 1st, 2017. So this would sunset that section of the law, and then everything else would go forward. And so the bill takes effect June 1st, 2022, except as provided with all these other effective dates. And we'll make sure they all align correctly, because I think I made a mistake or two here with that too, but we'll make sure that everything is in simpatico regarding the effective dates.
There's one other issue I wanted to bring.
Yes, you should have it in front of you also.
So, the issue of odor, if you remember, was kind of a hot topic, and probable cause. In other words, you know, if the only thing that the police officer smells has an odor of cannabis, does that constitute probable cause for searches and seizures? consistent with the Fourth Amendment and the rest. So we have an evolving body of case law in Maryland on this subject, and recently as 2021. So the bill is silent. Senator Carter's bill specifically just codified said that can't be probable cause, although even folks who are advocates didn't, her language, this is a complicated issue, and I'll to give you a couple reasons why. Number one, so the case law says that if odor alone would not allow or constitute the ability to stop and frisk somebody, for example, on the street. That's a so-called Terry search, like that is not sufficient for no other reason, well, a lot of reasons, you don't know anything. I mean, that's really highly problematic under the Fourth Amendment. But the courts have historically said that when you're talking about a car, your right of privacy is diminished because for a lot of reasons, not the least of which is you may have contraband that you're taking away. There are other reasons where there would be the ability, an exception for vehicle that it would allow you to search the car. Now, the Court of Appeals here in Maryland keeps changing as this subject keeps going. And last year in the Robinson case said, yes, odor can be alone enough to search the car. But where it gets complicated is if you were to try to draw a sort of an amendment and not just simply rely on the case law, it gets, and I think Senator Carter's bill is to the point, so under her, a fair reading of her amendment, if you went in there and it turned out it was an improper search and you found a dead body in the trunk or in the back seat, under her bill or language, you couldn't do anything about that. And also we have violation, if we have federal law still, these products are all in violation of federal law, so when you talk about probable cause, so it's highly problematic, I think, to draft the perfect odor provision. The House simply is silent, basically taking it and, relying on the current case law that continues to evolve. But the fact is, all the case law is pre-legalization. The question on the table is, does this all change when you talk about probable cause, when we're talking about post-legalization Maryland? And so what I have here, and this is something Chair Clippinger, well, not Chair Clippinger, that I came up with that I think may be a middle ground.
Is this the document?
Yes, that's it.
Yeah. So what I'm envisioning is what we do, this is before next session. You know how we get letters of advice from the Attorney General? There is something much higher than that, an actual formal opinion from the AG that takes actually a couple of months, several months to get, I'm sure some of you know. And what I'm proposing here is that ahead of the next session, before we've actually, all this is kicking in on this issue of odor, which I do think is important, raised by Senator Carter and others, that we get a formal opinion from the Attorney General as to his analysis in the post-legalization world. In other words, what does he think about some of this post-legalization? And I think we want the benefit of that before we were to propose or craft potentially some language in statute as opposed to relying entirely on the court, but I don't think we're there yet. And so I'm just putting that out there. The House bill's silent. This would be an uncodified language in this bill calling for us to get a formal Attorney General's opinion about the topic of odor alone and probable cause ahead of next session before everything's sort of truly kicked in on legalization. Anyway, for discussion, just putting it out there, it would be an uncodified language, and then we would remain silent based on current case law in the Court of Appeals from 2021, which I assume in 2023 will probably continue to shift and change, based on what we may do next year. So any thoughts or any objection to us putting this uncodified language in to, into the end of the bill? To get that kind of opinion? What's that?
I think we're gonna need some more time to think about all of this. This is a lot to take in, all in one.
That's fair. Now, there is some timeline here involving, I don't want to put it out there, but gubernatorial veto. So, not too long. If you want all this great criminal justice stuff and all this, just, be mindful of that.
But that was not my issue. I
I
never
hear
spoke
you.
in this committee or anywhere else about the criminal justice stuff.
Well, you didn't, and others may have a different view. I mean, you know,
Gotcha.
there are these things about funds.
No, but I think there's an assumption, there's
I'm
an
not making
incorrect
any
assumption
assumptions
being
about
made of who I
anything.
am
No.
and what I care about.
I'm not making assumptions about anything. I'm just.
You just said, if you care about this criminal justice stuff, and so that was implying that I cared about
Well,
that
I wasn't
more than
directing
some other
you.
pieces.
Okay.
Thank you.
Sarah Hayes, I wasn't directing it, I was talking broadly. I think, I said this at the beginning, I was saying for myself, that the way we looked at this was referendum, plus I think, this is me speaking, this was the statement I made at the beginning, was I thought a priority for this committee, not just sponsor, for the legislature, was getting rid of mass incarceration. This was not a true, this has nothing to do with you. I thought that was a priority for a lot of folks, so, that was my statement at the beginning, before we even opened up a discussion of this bill. So, you know, if it's on me, I'll accept responsibility. But what I would say, take the time you want, but, you know, we can debate this ad nauseum. These issues aren't going away next year or 2 years from now. If you want to deal with this tomorrow, we will. If somebody wants to take more time, there's a lot here. But look, it was not my intent, and if you interpret it that way, I apologize. I do apologize, because we have a great, I think, relationship in this committee. And I know, look, that's, this repair and reinvestment fund, which is in the bill, is well beyond all it's, you know, much broader. I mean, all these issues are broad. Well, it's in the bill. The bill that could be, you know, so, okay, let's shift. Forget about all that. What about this reinvestment repair fund? Is that important? If that's important to you, then there is a timeline. Let me just revamp everything I just said. Okay, with all that said, guys, thank you for your time, and we will reconvene at some point tomorrow. Okay, guys? Thanks a lot.